Welcome to all NORCET aspirants to my educational YouTube channel, Master Nursing Classes. Here we are dealing with the integrated sessions for neurology. So we have almost done with our topic regarding the anatomy, physiology, and base for our medical surgical nursing. So ನಾವು ಇಲ್ಲಿ ಇವಾಗ ಪಾರ್ಟ್ 8 ವಿಡಿಯೋನ ನೋಡ್ತಿದ್ವಿ. ಸೊ ಇದ್ರ ಹಿಂದ್ಗಡೆ ನಾವು ಇನ್ ಡೀಟೇಲ್ ಆಗಿ ಕ್ರೇನಿಯಲ್ ನರ್ವ್ಸ್ ಬಗ್ಗೆ, ಅದ್ರ ಫಂಕ್ಷನ್ಸ್ ಬಗ್ಗೆ, ಯಾವ ಕ್ರೇನಿಯಲ್ ನರ್ವ್ಸ್, ಮೋಟರ್ ನರ್ವ್ಸ್, ಯಾವುದು ಸೆನ್ಸರಿ ನರ್ವ್ಸ್, ಸೊ ಅದ್ರ ಹೇಗೆ ಫಂಕ್ಷನ್ ಅಸೆಸ್ ಮಾಡಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಇನ್ ಡೀಟೇಲ್ ಆಗಿ 1 hour ವಿಡಿಯೋ ಅಪ್ಲೋಡ್ ಮಾಡಿದ್ದೆ. ಸೊ ಇವಾಗ ನಾವು ನೆಕ್ಸ್ಟ್ ಟಾಪಿಕ್ ಹೋಗ್ತಿದ್ವಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟಾಪಿಕ್, ಆಟೋನಮಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್. ಇನ್ ಆಟೋನಮಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ವಿ ಆರ್ ಡೀಲಿಂಗ್ ದಿ two main important topics, that is sympathetic and parasympathetic nervous system. So very important topics for your NORCET examination. If you understand entire sympathetic and parasympathetic nervous system means you will easily understand your entire pharmacology, that is what all are the drugs comes under the sympathomimetics, what all are the direct adrenergics, what all are the direct cholinergics. So you will understand each and every point very easily. So you have to study this class before studying your pharmacology, because it creates a strong base for your pharmacology. Okay, so here we are dealing with the very important topic, that is autonomic nervous system. In that we are dealing here the parasympathetic nervous system. In next session we will continue with the sympathetic nervous system. Okay, so before moving to our main class, here is one beautiful quote, that is the failure is a not opposite of the success, and it's a part of the success. Friends, you have to believe that failure is not a opposite of the success. Failure is a part of the success. So in life there is no failure means we don't know the real value of the success. So because of that, so you don't consider failure as in separate or failure as an opposite of the success. It is a part of our journey. It is part from where we will start, and it is a base for our journey where we will learn more things from that, and we will implement those things we have understand by our failures. So we will go to our main goal, that is success. Okay, so don't consider failure as a opposite of success. It's a part of the success. Okay, so we will go to our today's class. In previous classes we have done with very important topics, that is in nervous system. So we have studied the central nervous system. We have seen the very important all the things regarding the brain and all part of the brain, and we have seen regarding the spinal cord also. If you have not seen these videos means, after completing this class you have to go to the my YouTube channel and click on the nervous system playlist. You will get all part 1 to part 7 videos in single playlist. Okay, so and we have seen regarding the somatic nervous system also. In this one we have discussed somatic nervous system means it's an voluntary, means it is in our control. So we have discussed regarding the sensory nerve, and we have discussed regarding the motor nerve already. Very in detail we have discussed on the sensory nerve and motor nerve. Okay, so this is also called as in the very good afferent nerve, and this is motor nerve is also called as efferent nerve. Okay, so we are here to at the final step of our nervous system. Okay, autonomic nervous system means auto means automatic, means it is not in our control. So we are studying with the nervous system which is not in our control. We are studying the nervous system which acts according to the situation. Okay, so that nervous system is called autonomic nervous system. Okay, also known as involuntary nervous system. In autonomic nervous system we will study the main two important parts, that is the sympathetic and parasympathetic nervous system. Okay, sympathetic and parasympathetic nervous system. First I will create base for the sympathetic and parasympathetic nervous system. Then we will study in detail regarding the parasympathetic nervous system and pharmacological clinical correlations on the parasympathetic nervous system. That is very important for your NORCET examination. Okay, so without wasting the time we will go for our today's class, that is autonomic nervous system. Autonomic nervous system, as I told, it is not in our control. Okay, it is not in our control means it regulates its own. Okay, like heart rate is not in our control. Okay, constricting the bronchi, dilating the bronchi is in not our control. Okay, respiratory rate is not in our control. So these all things are regulated by the autonomic nervous system that regulates automatically. Okay, it is involuntarily, means not in our control. Okay, voluntarily it will not in our voluntary. Okay, it is involuntary. So and it regulates the automatically according to the situations. Okay, according to the situation. Very important point. See, your body is cool, calm, resting peace. Resting means so in peace condition means so your body is metabolism is very much low. So at that point of the time, so our heart rate is normal, our respiration rate is normal. Okay, everything is normal. Okay, so when we are excited much, when we are in flight and flying mode. Okay, so at that point of the time, our heart rate increases, our bronchus dilates, our pupils dilates. So this is how our autonomic nervous system automatically regulates the our body functions according to the situations. Okay, very two types of the autonomic nervous system you will see very importantly. That is the sympathetic nervous system and parasympathetic nervous system. Okay, so before studying this one in detail, we will see from here the parasympathetic nervous system origin and from here the sympathetic nervous system origin. Okay, so we have seen this is our beautiful structure of the brain. Okay, and here is our midbrain. Okay, midbrain, and here this is our pons and this is our medulla oblongata. Okay, so I have told already cranial nerve number 1 2 is not having any nucleus or cell body. Cranial number 3 4 it originates from the where? From midbrain. Very good. And 5, 6, 7, 8 originates from the where? From our pons. Okay. And 9, 10, 11, 12, 4 cranial nerves originates from our medulla oblongata. Very good. So, here from the midbrain, one cranial nerve comes, that is the cranial nerve number 3. Okay. And from the pons, 7th cranial nerve number 7. And from the S, from our midbrain, from our medulla oblongata, cranial nerve number 9 and 10. 3, 7, 9, 10. Okay, you have to remember like this: 3, 7, 9, 10. So, while studying the vitamin K activated clotting factors, we will study the 2, 7, 9, 10 clotting factor number 2, 7, 9, 10. There we will study. Okay, that is vitamin K induced clotting factors. Okay, but here while studying the parasympathetic nerve origin in the from the brainstem. So we have to remember 3, 7, 9, 10 cranial nerve number 3rd, 7, 9, 10. Okay, these cranial nerves plus the part of the sacral nerve from the S2 to the S4. Okay, from S2 to the S4. So cranial nerve and these sacral nerves gives the origin for our parasympathetic nerves. So it is coming from the cranium. Okay, and it is coming from the sacrum. So we call this nerve origin as an craniosacral nervous system also. Okay, craniosacral nervous system. Parasympathetic nervous system is also called as craniosacral nervous system. Very important point. From where it origins, parasympathetic nervous system origins from the cranium, from the brainstem, the part of the brainstem, there the cranial nerves comes, and from the sacrum, from S2 to S4. Very importantly, so including the cranial bone nerves and the sacral nerves, our parasympathetic nerves originates. That is called craniosacral nervous system. Very important point for your NORCET examination. Okay, and here it comes our next slide. So where from the our sympathetic nervous system originates. Okay, from the spinal cord, thoracic number 1, nerve 2, lumbar number 2. Okay, from this T1 to L2, the nerve roots are sympathetic nerve root. Okay, these nerve roots are sympathetic nerve roots of sympathetic nervous system. Okay, also called as it is originating from the thoracic. Okay, and it is originating from the thoracic and lumbar. So we call this is an thoraco lumbar nervous system. Very importantly. Parasympathetic nervous system originates from the craniosacral area, and our sympathetic nervous system originates from the thoracolumbar area. Very important for your NORCET examination. Keep in your mind. Note it specially. Okay. Here we understand one beautiful note on this one. Just mention this one as note for NORCET. Okay. So when we see parasympathetic nervous system origin, so here is our nerve comes like this outside the body. Okay. And here is the group of the nerve cells outside the sinus is called, what we call these things. This is group of the nerve cell body outside the central nervous system is called ganglia. Okay. And group of the nerve cell inside the nervous system is called as nuclei. Very important. Very good. So this is ganglia, means this one is before the ganglia. We can say as in pre-ganglionic. Okay. Pre-ganglionic. And this is the after the ganglia. We can call this one as in post-ganglionic. Okay. Post-ganglionic. Very important point to understand for your NORCET examination is, while studying the peripheral nervous system origin, okay, sorry, parasympathetic nervous system origin, PSNS I will write in short form, parasympathetic nervous system origin. When we see the preganglionic nerves are long, okay, preganglionic nerves are long and postganglionic nerves are short, okay. So when the preganglionic nerves are long, postganglionic nerves are short, means that is our parasympathetic nervous system. While studying the sympathetic nervous system from the where, very importantly, okay, from the our lumbar one to the okay, sorry, thoracic one to the lumbar two. So from this origins, while studying the our sympathetic origin, see I am drawing the neuron here. So I have told already the group of the nerve cell body outside the sinus is called ganglion. Okay. See, this is our thoracolumbar origin. That is our sympathetic nervous system origin. This is called ganglia. Okay. So while studying the sympathetic nervous system, okay. So our this is before the ganglia. Preganglionic nerve is short, and the nerve root that comes after the ganglia is long. Okay, very important. Okay, postganglionic is long and preganglionic is short. Very important. So you have to remember that our what we call sympathetic nervous system originates from the thoracolumbar area. Very important point. Okay, and our parasympathetic nervous system originates from the craniosacral area. While studying the parasympathetic nervous system, so we'll study that our preganglionic nerve is long and postganglionic nerve is short. And while studying the sympathetic nervous system, our very importantly preganglionic nerve is short and postganglionic nerve is long. That is the important point. Okay, so here we will discuss the two types of the autonomic nervous system in short. Okay, see, this is our two types of the autonomic nervous system. That is the parasympathetic nervous system and sympathetic nervous system. Okay, so while studying the sympathetic nervous system, the basic we have to understand, when our body is okay cool, calm, rest and digest phase में है तो ಈ ಫೇಸ್ ಅಲ್ಲಿ ಇದ್ದಾಗ ಬಾಡಿ ಕೂಲ್ ಆಗಿದ್ದಾಗ, ಕಾಮ್ ಆಗಿದ್ದಾಗ, ರೆಸ್ಟಿಂಗ್ ಮತ್ತು ಡೈಜೆಸ್ಟಿಂಗ್ ಮೋಡ್ ಅಲ್ಲಿ ಇದ್ದಾಗ, ಸೊ ನಮ್ದು ಎಲ್ಲಾ ಬಾಡಿ ಸಿಸ್ಟಮ್ದು ನಾರ್ಮಲ್ ಆಗಿರ್ತವೆ, ಅಂದ್ರೆ ಕಂಟ್ರೋಲ್ ಇರ್ತವೆ, ಎಕ್ಸೆಪ್ಟ್ ದಿ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್. ಓಕೆ, ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಇಲ್ಲಿ ಹೆಚ್ಚಿಗೆ ಕೆಲಸ ಮಾಡುತ್ತೆ, ಅಂದ್ರೆ ಪೆರಿಸ್ಟಾಲ್ಸಿಸ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಸೊ ಸಲೈವೇಶನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಪೆರಿಸ್ಟಾಲ್ಟಿಕ್ ಮೂವ್ಮೆಂಟ್ಸ್ ಗಳು, ಬವಲ್ ಸೌಂಡ್ಸ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ಅವಾಗ ನಮ್ದು ಯಾವುದು ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಓಕೆ ಆಕ್ಟಿವೇಟ್ ಅಲ್ಲಿ ಇರುತ್ತೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಬಾಡಿ ಕೂಲ್, ಕಾಮ್, ರೆಸ್ಟ್ ಮತ್ತು ಡೈಜೆಸ್ಟಿಂಗ್ ಮೋಡ್ ಅಲ್ಲಿ ಇದ್ದಾಗ ಸೊ ನಮ್ದು ಏನಾಗುತ್ತೆ, ಬಾಡಿ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವೇಟ್ ಇರುತ್ತೆ. ಅದೇ ನಮ್ಮ ಬಾಡಿ ಬಂದ್ಬಿಟ್ಟು ಎಕ್ಸೈಟೆಡ್ ಆಗಿದ್ರೆ, ಓಕೆ, ಫ್ಲೈಟ್ ಮೋಡ್ ಅಲ್ಲಿ ಇದ್ರೆ, ಫ್ಲೈಟ್, ಫ್ಲೈಯಿಂಗ್, ಓಕೆ, ಮತ್ತೆ ಎಕ್ಸೈಟೆಡ್, ವಾಟ್ ಎವರ್ ಯು ಕಾಲ್. ಸೊ ಈ ಫೇಸ್ ಅಲ್ಲಿ ಇದ್ರೆ ನಮ್ಮ ಬಾಡಿ ಏನ್ ಮಾಡುತ್ತೆ, ಹೆಚ್ಚಿಗೆ ಫಂಕ್ಷನ್ಸ್ ಬೇಕು. ಸೊ ಅವಾಗ ನಮ್ದು ಹಾರ್ಟ್ ರೇಟ್ ಹೆಚ್ಚಿಗೆ ಆಗುತ್ತೆ, ರೆಸ್ಪಿರೇಟರಿ ರೇಟ್ ಹೆಚ್ಚಿಗೆ ಆಗುತ್ತೆ, ಬ್ರಾಂಕೋಸ್ ಡೈಲೇಟ್ ಆಗುತ್ತೆ, ಪ್ಯೂಪಿಲ್ಸ್ ಡೈಲೇಟ್ ಆಗುತ್ತೆ. ಆ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ಏನಾಗ್ಬಿಡುತ್ತೆ ಅಂದ್ರೆ ನಮ್ದು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವೇಟ್ ಆಗಿರುತ್ತೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಐ ವಿಲ್ ಗಿವ್ ಒನ್ ಎಕ್ಸಾಂಪಲ್. ಸಿ, ಈ ಮನುಷ್ಯ ಸುಮ್ನೆ ಒಂದು ರೋಡಲ್ಲಿ ಹೊರಟಿದ್ದಾನೆ ಅಂತ ಅನ್ಕೊಳ್ರಿ. ಸೊ ಇವನಿಗೆ ಸುತ್ತಮುತ್ತ ಯಾರು ಇಲ್ಲ, ಒಬ್ಬನೇ ಒಂದು ರೋಡಲ್ಲಿ ನಡ್ಕೊಂಡು ಹೊಂಟಿದ್ದಾನೆ. ಎದುರುಗಡೆ ಏನ್ ಬಂತು, ಒಂದು ಸಿಂಹ ಬಂತು ಅಂತ ಇಟ್ಕೊಳ್ಳಿ, ಒಂದು ಲಯನ್ ಬಂತು ಅಂತ ಇಟ್ಕೊಳ್ಳಿ. ಓಕೆ, ಸೊ ವೆನ್ ವಿ ಫೇಸ್ ದ ಲಯನ್, ಹಿ ವಿಲ್ ರನ್ಸ್. ಅವನ್ ಲಯನ್ ನೋಡಿದಾಗ ಓಡಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾನೆ. ಓಡಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕಂದ್ರೆ ಎಕ್ಸ್ಟ್ರಾ ಎನರ್ಜಿ ಬೇಕು. ಎಕ್ಸ್ಟ್ರಾ ಎನರ್ಜಿ ಬೇಕಂದ್ರೆ ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಆಗ್ಬೇಕು, ಬ್ಲಡ್ ಸಪ್ಲೈ ಎಲ್ಲ ಪಾರ್ಟ್ಗೂ ಜಾಸ್ತಿ ಹೋಗ್ಬೇಕು. ಸೊ ಆ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ನಮ್ದು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವೇಟ್ ಆಗುತ್ತೆ, ಅಂದ್ರೆ ಫ್ಲೈಯಿಂಗ್ ಮೋಡ್ ಅದು. ಓಕೆ, ಫ್ಲೈಯಿಂಗ್ ಮೋಡ್, ಎಕ್ಸೈಟೆಡ್ ಮೋಡ್. ಓಕೆ, ಸೊ ಅದೇ ಒಂದ್ ಮನುಷ್ಯ ಇವಾಗ ಆರಾಮಾಗಿ ಒಂದು ಯಾವ್ದೋ ಮೆಲೋಡಿಯಸ್ ಸಾಂಗ್ ಕೇಳ್ತಿದ್ದಾನೆ. ಸೊ ಜಸ್ಟ್ ಊಟ ಮಾಡಿ ಕೆಲಸ ಮಾಡ್ಬಂದು ಊಟ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಬಾಡಿ ಫುಲ್ ರೆಸ್ಟ್ ನೀಡಲ್ಲಿ ಇರುತ್ತೆ. ಆ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ನಮ್ದು ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವೇಟ್ ಆಗಿರುತ್ತೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್ ಫಾರ್ ಯುವರ್ ನಾರ್ಸೆಟ್ ಎಕ್ಸಾಮಿನೇಷನ್. ಸೊ ನೀವು ಏನ್ ಬೇಸಿಕ್ ತಿಳ್ಕೊಬೇಕು ನಿಮ್ ಎಂ ಸಿ ಕ್ಯೂ ಸಾಲ್ವ್ ಮಾಡಕಂದ್ರೆ ಇಲ್ಲಿ. ಸೊ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಎಲ್ಲಾನು ಕಡಿಮೆ ಆಗುತ್ತೆ. ಲೈಕ್ ಹಾರ್ಟ್ ರೇಟ್ ಕಡಿಮೆ ಆಗುತ್ತೆ, ರೆಸ್ಪಿರೇಟರಿ ರೇಟ್ ಕಡಿಮೆ ಆಗುತ್ತೆ, ಬ್ರಾಂಕಸ್ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಆಗ್ತವೆ, ಇದನ್ನು ಕಡಿಮೆ, ಪ್ಯೂಪಿಲ್ಸ್ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಆಗ್ತವೆ, ಬ್ರಾಂಕಸ್ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಆಗ್ತದೆ. ಸೊ ಇದು ಇಷ್ಟೆಲ್ಲ ಆಗ್ತವೆ. ಬಟ್ ಎಕ್ಸೆಪ್ಟ್ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಅಂತ ಹೇಳಿದ್ರೆ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಫಂಕ್ಷನ್ ಹೆಚ್ಚಿಗೆ ಆಗುತ್ತೆ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ಅಲ್ಲಿ. ಓಕೆ, ಅದಕ್ಕೆ ಇದು ಡೈಜೆಸ್ಟ್ ಅಂತ ಮೆನ್ಷನ್ ಮಾಡಿದ್ದೀನಿ ನಾನು ಒಂದು ವರ್ಡ್, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಡೈಜೆಸ್ಟ್ ಮಾಡಕ್ಕೆ ನಮ್ದು ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ರೆಸ್ಪಾನ್ಸಿಬಲ್. ಓಕೆ, ಸೊ ಜಿ ಎ ಫಂಕ್ಷನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಉಳಿದೆಲ್ಲ ಕಾರ್ಡಿಯಕ್ ಫಂಕ್ಷನ್, ರೆಸ್ಪಿರೇಟರಿ ಫಂಕ್ಷನ್ ಎಲ್ಲ ಕಡಿಮೆ ಆಗುತ್ತೆ, ಮತ್ತು ಮಸ್ಕ್ಯುಲರ್ ಫಂಕ್ಷನ್ ಎಲ್ಲ ರೆಸ್ಟ್, ಕೂಲ್, ಕಾಮ್ ಆಗಿರುತ್ತೆ. ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವ್ ಆಗಿರುತ್ತೆ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ. ಅದೇ ಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಆಗುವಾಗ ನೀವು ಎಲ್ಲಾನು ಆಕ್ಟಿವ್ ಆಗಿರುತ್ತೆ. ಕಾರ್ಡಿಯಕ್ ಸಿಸ್ಟಮ್ ಕೆಲಸ ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ, ರೆಸ್ಪಿರೇಟರಿ ಸಿಸ್ಟಮ್ ವರ್ಕ್ ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ, ಹಾಗೆ ಬಂದ್ಬಿಟ್ಟು ನಿಮ್ದು ಮಸ್ಕ್ಯುಲೋಸ್ಕೆಲೆಟಲ್ ಸಿಸ್ಟಮ್ ವರ್ಕ್ ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. ಬಟ್ ಅವಾಗ ನಿಮ್ದು ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ವರ್ಕ್ ಇರೋದಿಲ್ಲ. ಸೊ ಅವಾಗ ನಿಮಗೆ ಬವಲ್ ಸೌಂಡ್ ಕೇಳಿಸ್ ಬರೋದಿಲ್ಲ. ಸೊ ಅವಾಗ ನಿಮ್ಗೆ ಬಂದ್ಬಿಟ್ಟು ಕನ್ಸ್ಟಿಪೇಷನ್ ಫೇಸ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ ಪ್ರೊಲಾಂಗ್ ಸಿಂಪಥೆಟಿಕ್ ಪೀರಿಯಡ್ ಅಲ್ಲಿ ಇದ್ರೆ. ಸೊ ಈ ರೀತಿ ಆಗ್ಬಿಟ್ಟು ಸಿಂಪಥೆಟಿಕ್ ಮತ್ತು ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ನಮ್ಮ ಬಾಡಿಲಿ ವರ್ಕ್ ಮಾಡ್ತಾವೆ. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್ಸ್. ಸೊ ಇನ್ ಡೀಟೇಲ್ ನಾವು ಯಾವ್ಯಾವ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಹೇಗೆ ನಮ್ದು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್, ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ವರ್ಕ್ ಮಾಡ್ತಾವ ಅಂತ ತಿಳ್ಕೊಳ್ಳಿಕ್ಕೆ ಈ ಚಾರ್ಟ್ ನೀವು ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ 5 ಸ್ಟಾರ್ ಚಾರ್ಟ್ ಅಂತ ಬರ್ಕೊಳ್ಳಿ ನಿಮ್ದು. ಓಕೆ, ನಾರ್ಸೆಟ್ ಎಕ್ಸಾಮ್ಗೆ ಇದು 5 ಸ್ಟಾರ್. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಚಾರ್ಟ್. ಓಕೆ, ಸೊ ಇದೊಂದು ನಿಮ್ಗೆ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಆದ್ರೆ ನೀವು 10 ರಿಂದ 15 ಆಟೋನಮಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಆಗಿನ ಕ್ವಶನ್ ಗಳನ್ನ ಈಸಿಯಾಗಿ ಸಾಲ್ವ್ ಮಾಡ್ಬೋದು. ಓಕೆ, ಸೊ ನಾನು ನಿಮ್ಗೆ ಇಲ್ಲಿ ಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಬಗ್ಗೆ ಹೇಳ್ತೀನಿ ನೋಡಿ. ಫಸ್ಟ್ ಇದ್ರ ಬಗ್ಗೆ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ, ಆಮೇಲೆ ಇದ್ರ ಬಗ್ಗೆ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ, ಮತ್ತೆ ಒಂದ್ಸಾರಿ ಎರಡಕ್ಕೂ ಕಂಪೇರ್ ಮಾಡಿ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ. ಸಿಂಪಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ನೋಡಿ ಎಲ್ಲಿಂದ ಒರಿಜಿನೇಟ್ ಆಗಿದ್ದಾವೆ. ಸೊ ಒರಿಜಿನೇಟೆಡ್ ಫ್ರಮ್ ದಿ ಥೊರಾಸಿಕ್ ಏರಿಯಾ, ಓಕೆ, ಟು lumbar area. Okay, sorry, wait 1 minute. So it's originated from the T1 to L2. Okay, it's originated from the T1 to L2. Very importantly, the nerves ಎಲ್ಲ ಬರ್ತಿದಾವ್ ನೋಡಿ ಇಲ್ಲಿಂದ. ಸೊ ಈ ನರ್ವ್ಸ್ ಎಲ್ಲ ಬಂದ್ಬಿಟ್ಟು ನೋಡಿ ಪ್ಯೂಪಿಲ್ಸಿಗೆ ಡೈರೆಕ್ಟ್, ಪ್ಯೂಪಿಲ್ಸಿಗೆ ಸಪ್ಲೈ ಆದ್ರೆ ಅವಾಗ ನೋಡಿ, ಒಂದು ಮನುಷ್ಯ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಐ ವಿಲ್ ಟೇಕ್ ಹಿಯರ್ 1 minute. ಸೇಮ್ ಎಕ್ಸಾಂಪಲ್, ಲೈಕ್ ಮನುಷ್ಯ ಇದ್ದಾನೆ. ಸೊ ಸಿಂಗಲ್ ರೋಡ್ ಅಲ್ಲಿ ಒಬ್ಬನೇ ನಡ್ಕೊಂಡು ಹೋಗ್ತಿದ್ದಾನೆ, ಒಂದು ಲಯನ್ ಫೇಸ್ ಮಾಡಿದಾಗ, ಸೊ ಅವನ್ ಬಾಡಿ ಫುಲ್ ಏನಾಗ್ಬಿಟ್ಟಿರುತ್ತೆ, ಎಕ್ಸೈಟ್ ಫ್ಲೈಯಿಂಗ್ ಮೋಡ್ ಅಲ್ಲಿ ಇರುತ್ತೆ, ಅಲ್ಲಿಂದ ರನ್ ಅವೇ ಆಗ್ಬೇಕಲ್ಲ ಅದಕ್ಕೆ. ಸೊ ಅವಾಗ ಏನೇನ್ ರೆಸ್ಪಾನ್ಸ್ ಆಗುತ್ತೆ, ನಮ್ದು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವೇಟ್ ಆದಾಗ ಪ್ಯೂಪಿಲ್ಸ್ ಫುಲ್ ಡೈಲೆಟ್ ಆಗ್ತವೆ, ಯಾಕಂದ್ರೆ ವಿಷನ್ ಕ್ಲಿಯರ್ ಆಗ್ಬೇಕು. ಓಕೆ, ಸೊ ಆಮೇಲೆ ಬ್ರಾಂಕಸ್ ಫುಲ್ ರಿಲ್ಯಾಕ್ಸ್ ಆಗ್ಬಿಟ್ಟು ಡೈಲೆಟ್ ಆಗ್ತವೆ, ಯಾಕಂದ್ರೆ ಜಾಸ್ತಿ ಏರ್ ಒಳಗಡೆ ಹೋಗ್ಬೇಕು. ಓಕೆ, ಯಾಕಂದ್ರೆ ಆಕ್ಸಿಜನ್ ಬೇಕಲ್ಲ ಎಲ್ಲ ಸೆಲ್ಸ್ ಜಾಸ್ತಿ ಫಂಕ್ಷನ್ ಮಾಡ್ಬೇಕಂದ್ರೆ. ಓಕೆ, ಆಮೇಲೆ ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಡುತ್ತೆ. ಸೊ ಇನ್ಕ್ರೀಸ್ಡ್ ಹಾರ್ಟ್ ರೇಟ್ accelerates heart rate. Accelerates means increase, decelerates means decrease. You can understand by your bike accelerate in the sense increasing the speed. Okay, decelerate in the sense decreasing the speed. Okay, very important. ಹಾರ್ಟ್ ರೇಟ್ ಎಕ್ಸಲರೇಟ್ ಆಗುತ್ತೆ, ಬ್ರಾಂಕಸ್ ಡೈಲೇಟ್ ಆಗುತ್ತೆ. ಈ ಜೆ ಎಸ್ ಸಿಸ್ಟಮ್ ಹೇಳ್ತೀನಿ ರೀ. ಆಮೇಲೆ ಸೊ ಸಿಕ್ರೇಷನ್ ಆಫ್ ದಿ ಅಡ್ರಿನಲಿನ್ ಅಂಡ್ ನಾರ್ ಅಡ್ರಿನಲಿನ್ ಫ್ರಮ್ ದಿ ಅಡ್ರಿನಲಿನ್ ಕಾರ್ಟೆಕ್ಸ್ ಆರ್ ಮೆಡುಲಾ. ನಾಟ್ ಫ್ರಮ್ ಕಾರ್ಟೆಕ್ಸ್, ಇಟ್ಸ್ ಫ್ರಮ್ ಮೆಡುಲಾ. ಓಕೆ, ಸೊ ನಮ್ದು ಅಡ್ರಿನಲಿನ್ ಕಾರ್ಟೆಕ್ಸ್ ಬಂದ್ಬಿಟ್ಟು ಎಂಡೋಕ್ರೈನ್ ಸಿಸ್ಟಮ್ ರೆಗ್ಯುಲೇಟ್ ಮಾಡುತ್ತೆ. ಅದಕ್ಕೆ ಅಡ್ರಿನೋ ಕಾರ್ಟಿಕೋಟ್ರೋಪಿಕೋ ಹಾರ್ಮೋನ್ ರಿಲೀಸ್ ಆಗ್ಬಿಡುತ್ತೆ ಪಿಟ್ಯೂಟರಿಯಿಂದ, ಅದು ಬಂದ್ಬಿಟ್ಟು ಆಕ್ಟ್ ಮಾಡುತ್ತೆ ನಮ್ದು ಅಡ್ರಿನಲ್ ಕಾರ್ಟೆಕ್ಸ್ ಮೇಲೆ. ಸೊ ಅವಾಗ ಅಡ್ರಿನಲ್ ಕಾರ್ಟೆಕ್ಸ್ ಇಂದ ಈ ಗ್ಲೂಕೋಕಾರ್ಟಿಕೋಡ್, ಮಿನರಲ್ ಕಾರ್ಟಿಕೋಡ್, ಸೆಕ್ಸ್ ಕಾರ್ಟಿಕೋಡ್ಸ್ ಹಾರ್ಮೋನ್ಸ್ ರಿಲೀಸ್ ಆಗ್ತವೆ. ಬಟ್ ನಮ್ದು ಅಡ್ರಿನಲಿನ್ ಮೆಡುಲ ಏನಿದೆ ಅದು ನಮ್ದು ಆಟೋನಮಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಇಂದ ರೆಗ್ಯುಲೇಟ್ ಆಗುತ್ತೆ. ಅಲ್ಲಿಂದ ಅಡ್ರಿನಲಿನ್ ಮೆಡುಲ ಒಳಗಡೆ ಸೊ ಏನು ಕ್ರೊಮಾಫಿನ್ ಸೆಲ್ಸ್ ಇರ್ತವೆ, ಆ ಕ್ರೊಮಾಫಿನ್ ಸೆಲ್ಸ್ ಇಂದ ಅಡ್ರಿನಲಿನ್, ನಾರ್ ಅಡ್ರಿನಲಿನ್ ಅಥವಾ ಎಫಿನೆಫ್ರಿನ್, ನಾರ್ಎಫಿನೆಫ್ರಿನ್ ರಿಲೀಸ್ ಆಗುತ್ತೆ. ಸೊ ಎಫಿನೆಫ್ರಿನ್, ನಾರ್ಎಫಿನೆಫ್ರಿನ್ ರಿಲೀಸ್ ಆದ್ರೆ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಸಿಂಪಥೆಟಿಕಲಿ ಎಫಿನೆಫ್ರಿನ್, ನಾರ್ಎಫಿನೆಫ್ರಿನ್. ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕಲ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್ ಯಾವ್ದಂದ್ರೆ ಅದು ನಮ್ದು ಅಸಿಟೈಲ್ ಕೋಲಿನ್. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಅಡ್ರಿನಲಿನ್ ನಾರ್ ಅಡ್ರಿನಲಿನ್ ರಿಲೀಸ್ ಆಗ್ಬಿಟ್ರೆ ಸೊ ಅದೇ ಹೋಗ್ಬಿಟ್ಟು ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಮಾಡುತ್ತೆ, accelerates the heart rate. Okay, it dilates the bronchi and it dilates the pupils also, because there is an receptors present on that. I will discuss in detail related to the sympathetic nervous system, receptors of the sympathetic nervous system, each and every part. Okay, and it inhibits the bladder contraction. Okay, so in the sympathetic nervous system bladder contraction ಆಗಲ್ಲ. And very importantly, so it stimulates the organs. ಸೊ ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಇರುತ್ತೆ ಇಜಾಕ್ಯುಲೇಷನ್ ಅಲ್ಲಿ, ನಾಟ್ ಇನ್ ಇರೆಕ್ಷನ್. ಓಕೆ, ಸೊ ಇರೆಕ್ಷನ್ ಅಲ್ಲಿ ಇರೋದು ನಮ್ದು ರೆಸ್ಟ್, ಕೂಲ್, ಕಾಮ್ ಕಂಡೀಷನ್ ಅಲ್ಲಿ. ಸೊ ಆ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ಇರೆಕ್ಷನ್ ಆಫ್ ದಿ ಪೆನಿಸ್ ಅಂಡ್ ಇರೆಕ್ಷನ್ ಆಫ್ ದಿ ವೆಜನಲ್ ಕ್ಲೈಟೋರಿಸ್ ಆಗುತ್ತೆ. ಸೊ ಯಾವಾಗ ಇಜಾಕ್ಯುಲೇಷನ್ ಆಗುತ್ತೆ ಅವಾಗ ಪರ್ಸನ್ ಈಸ್ ಇನ್ ದ ಸಿಂಪಥೆಟಿಕ್ ಸಿಸ್ಟಮ್ ಕಂಡೀಷನ್. ಓಕೆ, ಅಂಡರ್ ದ ಸಿಂಪಥೆಟಿಕ್ ಕಂಟ್ರೋಲ್. So that is the important point you have to understand for your NORCET. I have one separate slide for this because that is a very important point for your NORCET examination. I will discuss here. So ನಾನು ಸಿಂಪಥೆಟಿಕಲ್ ಏನೇನ್ ಹೇಳಿದೆ, ಎಲ್ಲಾ ಬಾಡಿ ಫಂಕ್ಷನ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸಿ, ಪ್ಯೂಪಿಲ್ ಡೈಲೇಟ್ ಆಯ್ತು, ನಮ್ ಕ್ಲಿಯರ್ ವಿಷನ್ ಸಿಕ್ತು. ಬ್ರಾಂಕಸ್ ಡೈಲೇಟ್ ಆಯ್ತು, ಜಾಸ್ತಿ ಆಕ್ಸಿಜನ್ ಒಳಗಡೆ ಹೋಯ್ತು. ಸೊ ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಆಯ್ತು, ಹಾರ್ಟ್ ರೇಟ್ ಇನ್ಕ್ರೀಸ್ ಆಗ್ಬಿಟ್ಟು ಸೊ ಬಾಡಿಗೆ ಬ್ಲಡ್ ಸಪ್ಲೈ ಜಾಸ್ತಿ ಹೋಯ್ತು ಅಂದ್ರೆ ಅದು ಬಾಡಿಗೆ ಎಲ್ಲ ಕಡೆ ನ್ಯೂಟ್ರಿಷನ್ ಜಾಸ್ತಿ ಹೋಯ್ತು. ಸೊ ನಮ್ಗೆ ರನ್ ಅವೇ ಮಾಡಕ್ ಹೆಲ್ಪ್ ಮಾಡ್ತಿದೆ, ಮುಂದಿಂದ ರನ್ ಅವೇ ಮಾಡಕ್ ಹೆಲ್ಪ್ ಮಾಡ್ತಿದೆ. ಬಟ್ ನೋಡಿ, ಎಲ್ಲೆಲ್ಲಿ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಇದೆ, ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಫಂಕ್ಷನ್ ಎಲ್ಲ ಕಮ್ಮಿ ಆಗ್ತಿದೆ. ಸಿ, ಅವರ್ ಸಲೈವಾ ರಿಲೀಸಿಂಗ್ ಫ್ರಮ್ ದಿ ಅವರ್ ಪ್ಯಾರಟೈಡ್ ಗ್ಲ್ಯಾಂಡ್, ಸಬ್ಲಿಂಗ್ವಲ್ ಗ್ಲ್ಯಾಂಡ್ ಡಿಕ್ರೀಸ್ ಆಗ್ತಿದೆ. ನಾನು ಹೇಳಿದೆ ಎಕ್ಸೆಪ್ಟ್ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಅಂತ. ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವಿಟಿ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಓಕೆ, ಉಳಿದಿವ್ ಎಲ್ಲ ಆಕ್ಟಿವಿಟಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಸಿಂಪಥೆಟಿಕಲ್. ಅದೇ ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕಲ್ ಬಂದ್ರೆ ಎಲ್ಲ ಆಕ್ಟಿವಿಟಿ ಕಡಿಮೆ ಆಗುತ್ತೆ, ಸಿಂಪಥೆಟಿಕ್ ಆಕ್ಟಿವಿಟಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಓಕೆ, ಸಾರಿ, ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ಆಕ್ಟಿವಿಟಿ ಸಿಸ್ಟಮ್ ಓದ್ಬೇಕಾದ್ರೆ ಜಿ ಎಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವಿಟಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಉಳಿದ ಎಲ್ಲಾ ಆಕ್ಟಿವಿಟೀಸ್ ಕಡಿಮೆ ಆಗ್ತವೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್ ಫಾರ್ ಯುವರ್ NORCET examination. Okay, see, our salivary glands which is an accessory part of our GI system, so there is decrease function. Okay, here is the increase function, decrease function. Okay, so stomach do inhibit ಆಗುತ್ತೆ peristaltic movement. So again GI system decreased function and stimulates the glucocorticoid production. So ಇಲ್ಲಿ ಗ್ಲೂಕೋಕಾರ್ಟಿಕಾಯ್ಡ್ ಪ್ರೊಡಕ್ಷನ್ ಆಗ್ಬಿಟ್ಟು ಗ್ಲೂಕೋಸ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಡುತ್ತೆ, ಬಟ್ ಲಿವರ್ ಎಂಜೈಮ್ಸ್ ಗಳು ಡಿಕ್ರೀಸ್ ಆಗ್ತವೆ. ಓಕೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಅಂಡ್ ಸಿಕ್ರೇಷನ್ ಫ್ರಮ್ ದಿ ಅಡ್ರಿನಲಿನ್, ನಾರ್ ಅಡ್ರಿನಲಿನ್, ಇದು ರಿನಲ್ ಸಿಸ್ಟಮ್, ಅದು ಸಪರೇಟ್ ಆಗಿ ವರ್ಕ್ ಮಾಡುತ್ತೆ. ಪೆರಿಸ್ಟಾಲಿಸಿಸ್ ಏನಾಗ್ಬಿಡುತ್ತದೆ, ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಆಕ್ಟಿವ್ ಆದಾಗ ಪೆರಿಸ್ಟಾಲಿಟಿಕ್ ಕಡಿಮೆ ಆಗ್ಬಿಡುತ್ತೆ. ಪ್ಯಾರಾಸಿಂಪಥೆಟಿಕ್ ಆಕ್ಟಿವಿಟಿ ಜಾಸ್ತಿ ಆದಾಗ peristaltic movement of the GI system ಏನಾಗ್ಬಿಡುತ್ತೆ, very importantly increase ಆಗ್ಬಿಡುತ್ತೆ. Okay, so this is how you compare and study the sympathetic and parasympathetic nervous system. Very important for your NORCET examination. Okay, so pupils dilate ಆಗುತ್ತೆ, bronchus dilate ಆಗುತ್ತೆ, ಹಾರ್ಟ್ ರೇಟ್ ಇನ್ಕ್ರೀಸ್ ಆಗುತ್ತೆ, ಪೆರಿಸ್ಟಾಲಿಟಿಕ್ ಕಮ್ಮಿ ಆಗುತ್ತೆ, ಲಿವರ್ ಎಂಜೈಮ್ ಫಂಕ್ಷನ್ ಕಮ್ಮಿ ಆಗುತ್ತೆ, ಕಿಡ್ನಿಯಿಂದ ಅಡ್ರಿನಲಿನ್ ಮೆಡುಲಿಂದ ಅಡ್ರಿನಲಿನ್ ನಾರ್ ಅಡ್ರಿನಲಿನ್ ರಿಲೀಸ್ ಆಗ್ತವೆ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಮತ್ತು ಸೊ ಇಜಾಕ್ಯುಲೇಷನ್ಸ್ಗೆ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಸಿಂಪಾಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಇಂದ. ಓಕೆ, ಸೊ ಜೆನೆಟಲ್ ಆರ್ಗನ್ಸ್ ಬಂದ್ರೆ ಮತ್ತು ಬ್ಲಾಡರ್ಸ್ ಬಂದ್ರೆ ಬ್ಲಾಡರ್ ಏನಾಗ್ಬಿಡುತ್ತೆ, ಸಿಂಪಾಥೆಟಿಕ್ ನರ್ವ್ ಸಿಸ್ಟಮ್ ಜಾಸ್ತಿ ಆದ್ರೆ ಬ್ಲಾಡರ್ ಡೈಲೇಟ್ ಆಗಿ ಅಂದ್ರೆ ಕಂಟ್ರಾಕ್ಟ್ ಆಗಲ್ಲ. ಓಕೆ, so that is very important. And when it comes for the parasympathetic nervous system, each and every part comes to the ground, means it is in the normal conditions, that is heart rate normal, everything is normal. But when parasympathetic nervous system activates, GI system function activates, because in the sympathetic nervous system GI system activity is decreased. Okay, so in parasympathetic nervous system GI system activity increases, rest all activities decreases. See, pupils ಏನಾಗ್ಬಿಡ್ತಿದೆ ಇಲ್ಲಿ ಕಂಟ್ರಾಕ್ಟ್ ಆಗ್ಬಿಡ್ತಿದೆ. ಓಕೆ, ನಾವು ರೆಸ್ಟಿಂಗ್ ಪೀರಿಯಡ್ ಅಲ್ಲಿ ನಾವು ಏನನ್ನ ಕ್ಲಿಯರ್ ಆಗಿ ನೋಡೋದ್ ನೆಸೆಸರಿ ಇಲ್ಲ. ಸಡನ್ ನಮ್ಮ ಪೀಪಲ್ಸ್ ಡೈರೆಕ್ಟ್ ಆಗ್ಬಿಟ್ಟು ನಮ್ಗೆ ಎದಕ್ಕೂ ರೆಸ್ಪಾನ್ಸ್ ಮಾಡೋದ್ ಇರುತ್ತಿಲ್ಲ, ಯಾಕಂದ್ರೆ ನಾವು ರೆಸ್ಟ್ ಕೂಲ್ ಕಾಮ್ ಅಲ್ಲಿ ಇದೀವಿ. ಓಕೆ, ಸೊ ಅದಕ್ಕೆ ಏನ್ ಹೇಳ್ತೇವೆ, ಕಂಟ್ರಾಕ್ಟ್ಸ್ ಆಫ್ ದಿ ಪೀಪಲ್ಸ್ ಅಂತ ಹೇಳ್ತೇವೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ಲಿ ಕಂಟ್ರಾಕ್ಟ್ಸ್ ದ pupils. Okay, and it increases the GI system function, that is increases the salivation. Okay, so and it constricts the bronchi. Okay, all functions decrease. I'm telling, slow heartbeat decrease. Okay, and here is the again GI system activity stimulates the peristaltic and secretion, increase GI system activity, stimulates the bile release, increase the GI system activity, and it contracts the bladder. Very important. And sympathetic nervous system, what it is doing, it is inhibiting the bladder contraction, but it is increasing the bladder contraction. Okay, it is inhibiting the bladder contraction, very important. And it is responsible for the penile and vaginal clitoris erection. See, at the point of the summary, we have to understand this is that much only. In sympathetic nervous system, each and every function of the all system is increasing, like cardiac system is increasing, respiratory system increasing, except GI system and except the bladder control system. Okay, because in sympathetic nervous system bladder is relaxing. Okay, and in parasympathetic nervous system bladder is contracting. Okay, and sympathetic nervous system all activity increasing and our GI system activity decreasing. Similarly, when it comes to the parasympathetic nervous system, all the activities are coming in control, means decreasing, but GI system activity is increasing and bladder is contracting. This is very important point for your NORCET examination. You have to keep this concept in your mind while solving the multiple choice questions on this particular topic. You have to remember and implement this concept on that questions, so you can solve it very easily. Okay, so very important point for your NORCET 5-star point, right, for the NORCET examination. Okay, so penile erection and vaginal clitoris erection is under the parasympathetic nervous system control, and ejaculation of the sperm during the intercourse is under the sympathetic nervous system. Two very important questions you will get in your NORCET examination. Okay, note it down, special notes for your NORCET, very important. Okay, so we have done the comparison and basic with the sympathetic parasympathetic nervous system here. So we will study in detail related to the our parasympathetic nervous system here. Okay, see, parasympathetic nervous system, the main neurotransmitter, that is acetylcholine. What is neurotransmitter? Neurotransmitter is a chemical messenger that helping the message to transfer from here to where? Yes, presynaptic nerve to the postsynaptic nerve. Very important. So already I have told on the neurotransmitter while studying the basic of our neurology. There I have discussed what is the neurotransmitter, and I have given notes regarding to the definition of the neurotransmitter also. So in while studying the parasympathetic nervous system, so very important or the main neurotransmitter is the acetylcholine. Means if you are increasing the acetylcholine, parasympathetic nervous system increasing. Okay. If you are decreasing the acetylcholine, parasympathetic nervous system decreasing. Very important point. Okay. Means if you are increasing the acetylcholine, all the parasympathetic activity increasing, means your pupil is getting constricting and bronchus is getting constricting and heart rate become decreasing, respiratory rate become decreasing, yes, and all the JS system activity increasing and bladder construction increasing. Okay, very important point. So you are decreasing the acetylcholine, means you are decreasing the parasympathetic nervous system, means you are increasing the sympathetic nervous system. So by manipulating this acetylcholine, there are many thousand plus of the drugs in your market. So this is the your base for the pharmacology. Okay, you will study that cholinergics drugs, anticholinergics drugs. Cholinergics drugs means those medications which increasing the acetylcholine, means which increasing the parasympathetic nervous system. Okay, and anticholinergics are those drugs which decreasing the acetylcholine. Okay, means which decreasing the parasympathetic nervous system, in the sense it's increasing the sympathetic nervous system. Very important. Okay, so acetylcholine is the very important neurotransmitter. Acetylcholine increase means parasympathetic nervous system increases, and acetylcholine decrease means parasympathetic nervous system decreases. Very important. Okay, and main two receptors we are having here is the nicotinic receptors and muscarinic receptors. Okay, muscarinic receptors and nicotinic receptors, very important. We will study regarding these receptors because these receptors are the base for studying the disease called myasthenia gravis in your neurology study. Okay, so there is damage for the nicotinic muscarinic receptors, so you will not understand. If you are seeing this class, means you have to note this separately for your myasthenia gravis study purpose, because this is the base for your myasthenia gravis study. Okay, very importantly. Okay, two kind of the receptors we are having, nicotinic and muscarinic receptors. In nicotinic, again two types of receptors will come, and in muscarinic again five types of the receptors will come. I will tell next, in next slide I will discuss that one. Okay, so this parasympathetic nervous system is also called as in the cholinergic nervous system, because here is the acetylcholine is increasing. So cholinergic nervous system we call the parasympathetic nervous system. Okay, and this is also called as the rest and digest nervous system, because parasympathetic nervous system is active when the body is in the rest and in the digest mode. Okay, very important point. So parasympathetic nervous system is also called as cholinergic nervous system. Okay, and the process of increasing the acetylcholine is called cholinergics also, and the parasympathetic nervous system is also called rest and digest nervous system, because this nervous system activates when the body is in the condition of the rest and digest. Very important point. Okay, so here we comes for the parasympathetic receptors. So first one receptors we are having the nicotinic receptors. Second one is the muscarinic. We will discuss on this one first. So after this we will go for the our next muscarinic receptors. Okay, so this nicotinic receptor, if it present on the muscle means, okay, if it present on the muscles means, so that nicotinic receptors we will write as nicotinic receptors present on the muscle, NM. Okay, this is called muscarinic. This is called muscarinic nicotinic receptor. Okay, what you call this is muscarinic nicotinic receptor. Very important point. Okay, if this nicotinic receptor is present on the nerve cell body, means present on the nerve cell body means, so this is how we will write this one as like this. This is called neuronal nicotinic receptor. What we call this is a neuronal, very important, nicotinic receptor. So this is the two kind of the receptors we are having the nicotinic receptors, that is the muscarinic nicotinic receptor and neuronal nicotinic receptors. How we will write that receptors as an like this. Okay, N M, capital N in big size and capital M in small size. Okay, Like this we will write, very important point. So this muscarinic receptor present at the muscles while studying the neuromuscular junction. See, here is the your neuromuscular junction. This receptors I am talking about. Okay, this receptors I am talking about. These are all called nicotinic muscarinic receptors. Okay, nicotinic muscarinic receptors. These all green color. See, from this is our axon of the nerve. Okay, axon of the nerve. Here is your vesicles. Okay, synaptic vesicles. In the inside the vesicles only neurotransmitters present. Where the neurotransmitters will store at the synaptic means near the synaptic area means in the vesicles. Very important point. Okay, so this gap is called synapse. Okay, okay, synapse or synaptic. This junction is called as the synapse, and this gap is called synaptic cleft. Okay, what we call this one is synaptic cleft. So this is membrane is before the synaptic cleft, that is called presynaptic membrane, and this membrane is after the synaptic cleft. So this is called postsynaptic membrane. Okay, this one is called postsynaptic membrane, and here this one is called presynaptic membrane. Okay, very important. When there is an action potential comes, when there is a nerve signals comes like this, so from here, from vesicles, the acetylcholine will get released. Okay, acetylcholine will get released, and which acts on the receptors. These receptors are called ACH receptors. On the muscles means this receptor present on the muscles means this is called our nicotinic muscarinic receptors. Very important. Okay, this is how we will study our neuromuscular junction. Uh, this is the basic what we need to understand here. Okay. So this is the parasympathetic, two kind of the nicotinic receptors we have seen. That is the muscarinic nicotinic receptor and neuronal nicotinic receptors. Okay. So while studying the muscarinic receptors, we have the again five types of the muscarinic receptors here. Very important. I will not discuss in detail about this much. You see, whatever the thing necessary for your competitive examination, I am telling here. Okay. Five types of the muscarinic receptors are there. M1, M2, M3, M4 and M5. Okay. So this M1 receptor present in our brain. Okay. Present in the brain. So from the in the brain when the acetylcholine acts on this one. Okay. So acts on this M1 receptors. So our brain cognitive functions becomes increased. Okay. So because of this, when there is damage to the muscarinic receptors in the brain, or if there is any deficiency of the acetylcholine in the brain, so we will study that one as an Alzheimer's disease. Okay, Alzheimer's disease or Alzheimer's dementia. Okay, Alzheimer's dementia. In this condition, there is decreased cognition, means decreased calculating ability, decreased judgmental process. So everything goes alters here. Okay, so that is the Alzheimer's disease we will study while studying the M1 receptors. That is the acetylcholine deficiency inside the brain. Okay, so if there is any acetylcholine deficiency in the neuromuscular junction means, so that one if there is any acetylcholine deficiency here at the neuromuscular junction means, so or if there is any damage to these nicotinic muscarinic receptors or ACH receptors means, this one we study as an very important, that is myasthenia gravis. Okay, myasthenia gravis, very important point. Okay, and this M1 receptor present on our GI system also, GI tract also. So it's if there is any parasympathetic stimuli comes means this system which gets stimulates and increases the peristaltic and increases the HCl. Okay, hydrochloric acid. And our M4 and M5, these receptors present on the brain only and spinal cord. Okay, So the receptors, muscarinic receptors, which are present on the central nervous system is, we can say, M4, M5 and M3, M2 receptors, which is present on the most of our body conditions. Okay, here in the gastrointestinal tract. Okay, where we comes for our bronchi. Okay, where we comes for our heart. Okay, like in GI system, if the parasympathetic nervous system activates means all activity increases. So bronchus constrict, heart rate decreases. Okay, and this is present in our pupils also. Okay, eye pupils. So pupils get constrict in parasympathetic nervous system. So constriction of the pupil, what we call meiosis. Our pupils get constricted means that is called meiosis, and if pupils are get dilated means that is called mydriasis. Okay, what is mydriasis? Dilated pupils is called mydriasis. Very important. These are all the five type of our muscarinic receptors. We have to understand M1, M2, M3, M4, M5. Among those, M4, M5 is present in CNS, and M1 is also present in the CNS. So M1 is responsible for the creating receptors for the acetylcholine. So if there is any damage to the muscarinic 1 receptor, or if there is any deficiency of the acetylcholine, so that disease condition we call as an Alzheimer's disease. So that is the ACH deficiency inside the brain. So in case ACH deficiency in the neuromuscular junctions means, that is called myasthenia gravis. So in both condition, which as neurotransmitter deficiency is there, in both condition deficiency of the acetylcholine is there. But in the myasthenia gravis, acetylcholine deficiency in the neuromuscular junction, and in the Alzheimer's disease, deficiency of the acetylcholine inside the central nervous system, that is in the brain. Okay, that is what you have to understand importantly about the muscarinic receptors. Okay, here it comes our a very important part.